Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. I'd like to now introduce today's speakers, Rob Rosenberg and Donna Arbogast from Springboard Brand and Creative Strategy. Please take it away.
Hi, thank you. On behalf of AMA Private Practice Simple Solutions, welcome to the introduction of the Marketing, Branding, Learning Collaborative. I'm Rob Rosenberg, President of Springboard Brand and Creative Strategy, who along with my colleague Donna Arbogast will be developing and presenting the content in this education series. The agenda and objective for today's Learning Collaborative include understanding the value of marketing for practice growth and sustainability, identifying your practice differentiators, determining the best research tools for your marketing advantage, using public relations and community outreach to support practice initiatives, and creating a digital presence. Next slide. As specialists in healthcare marketing, we believe that most brands have an inherent difference and distinct advantage. You just have to look for it. In the case of private practices, this advantage often lies in the interests, personality, and style of its practitioners and office operations. Additionally, your marketing advantage may be in the way the practice attracts new emerging markets or growing patient populations. Next slide. In terms of achieving practice differentiation, we'll look at 5 steps today. First, identify your strengths and unique attributes. Assess patient and community needs. Evaluate business operations, conduct a thorough competitive review, and finally, create your unique and relevant story. Well, let's get into it. Here's Donna Arbogast to talk about your practice differentiators and how to begin to identify your strengths and unique attributes. Donna?
Thank you, Rob. So as you described, the process of identifying the advantage that any organization or physician practice has in the market is actually quite logical. And our first step is to suggest that you work with your team to review some key questions that will uncover what sets your practice apart from others. Some of the questions to consider include, what special areas of interest or expertise do you and members of your team offer to patients? What strengths do you have in those areas? What do you do best? Do you offer any special or unique services, such as prevention or wellness visits or sports-related care, pediatrics and family medicine, or advanced testing or diagnostic capability, among other things? Is there a service or specialization that you would like to offer in the future, something that might fill a gap in care in your area or practice? And now consider what distinguishes you from other providers in the area. Do you offer a unique level of expertise, differentiating outcomes or recognitions, easier access such as online scheduling or same-day appointments, or excellent customer service related to your patient satisfaction scores? As you review the team's answers to these questions, begin to focus on what makes you a better choice for care than your competitors. And we'll talk about competition in a little more depth in a moment. Next slide. Our second step is to now assess your patients and community at large to develop a profile of your current customer base and identify other opportunities. And we can start by looking at the demographics of your current patients, including their age, gender, ethnicity, and other details. This information will help you identify who you currently serve. Now we can look more broadly at your community. Are there any special health needs that your practice can meet? For example, is there an industry in your area that increases certain health risks or conditions? Do you offer specialized expertise or services to address these risks? And could these be marketing opportunities for you? Does the population of your community require any special services or considerations, like weekend or extended hours or telehealth to make it easier for people to access you? And are there special interests or hobbies that are popular in your community that present health implications and also align with your practice's expertise? Finally, are there patient populations your practice would like to reach and attract? For example, these could include certain demographics such as older adults, young families, or weekend warriors who need prevention and treatment for sports injuries. Next slide. So we've looked at your practice strengths and interests, your patients and community. Now let's look at your operations. Do they align with your practice strengths and the patients you serve or want to serve? So using a customer lens, evaluate components of your practice, such as your hours and capacity, the accessibility of your offices in terms of location, parking, signage, your responsiveness to the needs and questions of your patients, your office environment and ambiance. Is it welcoming? Are all locations consistent? And then your website and social media pages. Are they clear, easy to navigate, and aligned with your patients' and community's interests? Next slide. Our fourth and final step is to take a careful look at your competition. Creating a marketing advantage not only takes into account the strengths and services of your practice, but must consider that of your competitors. While you most likely have positive relationships and referral relationships with other private practices, you want to make sure that your marketing advantage is not equally comparable to theirs or already being used in your community. So let's dig into this in a bit more detail. Take a moment to list your competitors, their name, location, and affiliation. For example, are they aligned with a hospital or health system? And if so, do they leverage that connection in any way? Based on your own experience and what you hear from your patients or what you read on their websites, do you know whether they offer any services or specializations that distinguish them from your practice? What is their presence in the community? Do they advertise? If so, what messages do they use? What do they claim as their market advantage? Do they sponsor or are they visible at local events? And finally, what are their vulnerabilities, particularly as you consider what you offer to your patients and the community? Next slide. So you're now at the stage where you'll be pulling all of this information together about your practice, your patients, the community you serve, and your competition to create your own brand story. You want to identify your best marketing advantage and put it into the form of a unique and relevant story for the marketplace. It should be unique in that it reflects the skills, interests, and personality of your practice, and it should be relevant in that it mirrors your current patient population, the community you serve, and new segments within it that you would like to attract. So with this work, you have taken a huge step toward creating a marketing plan that will help you grow your practice. And now Rob will describe in more detail some of the research that will help you gain even further insights into your patients and community. Next slide.
Thank you, Donna. Research has long been a staple in the marketing field. Let's now explore how private physician practices can better understand the role and methodologies of market research and the insights it can provide you for marketing and planning purposes. Next slide. There are two basic forms of research, primary and secondary. Primary research is when customized studies are developed to identify specific insights about a product or service. These studies can include quantitative research, such as surveys and other forms of numeric statistical data, or qualitative research, such as interviews and focus groups, whereby opinions and discussions are held to ascertain customer preferences. Next, secondary research. Back please. Secondary research is market information that already exists about your practice and/or the marketplace. Whether this is published data, articles, or other research studies, this kind of information is more readily available and faster to access. Before conducting primary research, many marketers review existing data and information to determine any gaps or comparisons that should be made to their specific brand. This information can now be gathered through sources, which we'll explore. Next slide. In terms of steps for implementing research, first, Conduct secondary research to better understand your community. Then, access these findings for practice alignment in terms of how you're currently presenting your services in the marketplace. Then conduct primary research into patient satisfaction for ongoing insights. And we'll take a look at each of these steps next. Next slide. Let's start by understanding your community, the population, and their needs. We're going to start by reviewing where to find information about your community specifically. A great deal of data that will be useful for your practice is available online. For example, you can learn about the population in your community by exploring census data provided by county, state, and federal websites. You'll be able to identify basic demographics about your community, as Donna mentioned, such as age, income, ethnicity, and education, as well as where market growth can occur in the market. For health behaviors and information, websites such as the CDC, health departments, and even your local hospitals can be reviewed to help you identify your community's needs when it comes to healthcare usage and service needs. Next slide. As you access these resources, you'll want to be looking for information about such issues as the prevalence of diseases in your community, particularly those relevant to your practice, such as diabetes, obesity, and certain types of cancer. Secondary research into your market will also help you know the occupational risks in your community, such as back injuries or other types of job site risks and exposures. Next slide. Now let's look at how to use secondary research to gather information specific to your patients and their experiences with you. Once again, we're going to turn to online resources. Reviews are a good place to start. Google reviews are readily accessible. Google your name and/or practice to view what patients write about their experiences with your services. Other sites that provide you with important ratings and reviews are listed here, from Yelp, social media sites, hospital affiliations, email messages, and so forth. If your practice has social media sites or a website, these can also share important attitude and perceptions that patients have about your practice. Next slide. As you go through all this information available to you online, consider these questions. Are you generating reviews, and are they positive? Remember, today's consumers rely heavily on reviews to make choices, so this is important to monitor regularly. Are there positive themes you need to build upon, or negative themes which need addressing? So now that you've gathered all this information and have begun to think about your practice in light of the needs of your community and patients, let's take a look at primary research, specifically for patient satisfaction. And Donna's going to walk you through this. Next slide.
Okay. Well, thank you, Rob. So as Rob described, primary research like online market surveys and focus groups are often used for baseline insights and trends across a region, but for provider practices, primary research like this is generally unnecessary because secondary research can give you all the information you need. On the other hand, there is one type of primary research that you will want to use in some ways to understand what your patients are thinking and experiencing on an ongoing basis. Patient satisfaction surveys, which are forms of primary research, are invaluable as you want to try to ensure that you are consistently meeting or even exceeding patients' needs and expectations. So we're going to offer you a 4-step process to developing and implementing patient satisfaction surveys. So the next slide, please. Your first step is to set your goals. Identify what you want to know from the survey. You will find some ideas for what you might need to know based on the secondary research that you conducted assessing your patients' current perceptions. For example, what trends did you find in the comments and reviews? And did they revolve around access or appointment scheduling, or were they more focused on attitude or communications? Using these insights, determine what you most want to know and need to know about your practice to help you build on your strengths and address any weaknesses. The second step is to create your survey. You want to keep it brief, about 5 questions. You want to use both closed and open-ended questions so that you really get a good sense from your patients about what they're thinking. So an example of a closed survey question might be, On a scale of 1 to 4, how would you rate X? An open-ended question might be, are there other services we could provide to help you manage your health better or improve your experience? Next slide, please. So step 3 is to determine your distribution method or methods. How are you going to get this survey into the hands of your patients? You might start with your patient portal because it is quite likely that there is a tool built into that that would allow you to send information and follow-up questions to patients. Or you could use the texts and emails that you already send to patients in your follow-up messaging, and you could include the survey link in those pieces in texts or emails. Another approach is to offer patients a survey encouragement card. So when a patient has a positive experience in your office, your team members could offer this card to the patient, and it could include the full short survey that could be completed in the office and dropped into a survey box, or you could put a QR code onto that card with a link to the survey that patients could complete online at their convenience. And finally, consider using posters in your office to encourage patients to take the survey, using language like, "We want to hear from you," or "Your opinion matters to us." Next slide. So the final step is follow-up. To ensure that your team members can appropriately follow up on both positive and negative comments, you can allow patients to include their name and contact information in the survey response if they choose to. So if they send a positive note, you want to send a thank you note back to them. A show of appreciation goes a long way. On the other hand, if you get a negative comment, you want to be able to call or email that patient as quickly as possible, because you want to learn more, you want to reassure the patient about steps you're taking to avoid such an experience in the future, and you want to be able to do some service recovery to keep that patient aligned with your practice. So also ask for permission to include their comments and materials throughout your office to encourage others to share their perspectives. And regularly review the survey responses with your team. These can be used for recognition of your team members, kudos, and it can also be used to serve as a guide for discussions about what might need to be changed or improved in your office environment. Next slide. So as you're thinking about what you want to ask your patients, we've got a few categories that we thought you could consider. So some categories of questions might be ease of finding a physician online and making an appointment, the attitude of the care team, ease of access, going back to that issue of location, parking signage, wait time, communication, bedside manner, the overall experience, their willingness to recommend you to others, and opportunities for improvement. Next slide. So up to this point, we've provided a step-by-step guide for you to identify your marketing advantage and conducting research that gives you the kinds of rich insights into your patients and community that you need to grow your practice. Now we're going to focus on the process of developing and nurturing trust with these groups, the people you currently serve, and the community in which you work. And we're going to talk about using public relations and community outreach strategies to do that. Next slide, please. To be sure we're on the same page, let's define our terms, because a lot of people have different perceptions of what these terms mean. So public relations is strategic communications that strengthens your reputation with key audiences, establishes you as a valued resource, and builds mutually beneficial relationships. In the past, many people consider public relations media relations. You would cultivate relationships with the media so that they would share stories that presented your organization in a positive light. Today, with the rise of digital channels, you can create and promote your own content via blogs, emailed newsletters, and social media that creates an ecosystem that will help you build relationships and trust and establish a leadership position. And you no longer need to rely on outside organizations to promote your practice in this way. Community outreach is an extension of PR, building relationships through events and local initiatives or sponsorships. Next slide. So why and when would you engage in public relations and community outreach efforts? Well, first, PR and outreach give you the opportunity to establish your practice as a trusted resource for health expertise, education, and information. While marketing and advertising tactics can support the efforts to drive immediate and measurable results, PR and outreach are longer-term investments in building a foundation of trust among those you serve. When do you use these tactics? Well, selection is key to success, sustainability, and to some extent, your sanity. You do not need to, nor should you, write or speak about every hot topic or say yes to every request to participate in or sponsor an event. Instead, you should strategically align or strategically select those initiatives that align with your marketing advantage, and each initiative should connect with and support the others. We'll explain a little how to do that. Next slide, please. So let's review the basics of blogging and make sure that your patients and communities see and read your articles. So blog content should always be informative and educational, not promotional. The messages should be relevant to your key audiences, which you can assess by reviewing the profiles you identified during the marketing advantage and research steps that you took. Ideally, you should also offer actionable insights in your blogs, something that people can do to improve their health. And these tidbits of information are perfect for promoting your full blog. A blog lives on your website, and you can promote it using social media, emails you send to patients, posters or brochures in your office, and at events in which you participate. Again, making that continued connection between all of these tactics. Next slide. As a general guide, your blog should be about 1,000 words. It can be longer, but it's valuable at about 1,000 words for search engine optimization, which means that your blog post would come up at the top of Google search results. You want to post at least once per week. More often is fine, but we know that that can be kind of daunting. So to help you manage, at least target once a week. You want to develop a content calendar that outlines the topics that you will be talking about, who will be writing the blog, who will be creating the promotional posts on social media, and what the deadlines are. Encourage members of your team to come up with ideas based on the questions they hear from patients and based on their own areas of interest and expertise. They can also write blogs and develop the promotional posts as well. It shouldn't fall all on one person's shoulders because that can be overwhelming. Next slide. And finally, as part of this section, let's talk a little bit about community outreach. Another way to build relationships is by participating in or sponsoring local events. So how do you determine which ones to take on and to participate in? You want to select events that align with your practice goals and the needs of your patients and community, have a track record of success at reaching your target audiences, require a minimal amount of your resources, staffing, materials, time, and funds, provide practice recognition in social media, signage, an organization's website, emails, etc., and align with your own content strategy. So topics that you've already selected to focus on in your blog should align with the kinds of events and sponsorships that you've decided to participate in. As we said earlier, for maximum impact and efficiency, everything you do should work together to help you achieve your growth goals and build long-term relationships. And now we're going to turn back again to Rob for more detailed insights into digital strategies.
Thank you, Donna. So digital strategies, of course, are becoming a must-have for all organizations, including physician practices. After all, it is the go-to for patients, those in your community, referral sources, and other important audiences. While there's a lot to get to know, this overview will provide you with knowledge and insights into the basic uses and strategies to consider in developing a digital presence. Next slide, please. Let's start with your website. Today, they don't have to be overly complicated or expensive to develop, but as said, it's important to have and maintain one. The homepage is the ideal place to highlight your unique story based on the work you've completed up to this point in terms of identifying your key differentiators and community needs. Your site should also feature brief bios and headshots. Positive patient testimonials. These can be mixed into the site for consumer credibility and interest. And as discussed in thought leadership, you should include your blog as well as events in which you'll be participating in the community. If you're just considering the development of a website, WordPress is an easy to use and universal platform to build. If you have questions about this, please reach out on the message board. Next slide. Social media is another important presence to have online. Facebook is still very popular and tends to reach an even older audience than Instagram or other channels. We'd recommend you start with these two platforms for your social media strategy and expand from there. Similar to your website, your social media posts should align with the unique story that you've developed and have determined to be most relevant and authentic. Creating social media posts is relatively easy once you've established your social media page. Remember, your social media posts should link back to your website. For example, if you've written a blog, you can make a social media post out of it, and then that content would ultimately link back to your website under your thought leadership. Other effective posts include introducing team members, announcing new services or new locations, or sharing other important information with your followers. Next slide. Purchasing digital media, it's a bit trickier, and we would recommend you hire a firm to help you with these endeavors. There are many ways to go about it, but the most basic strategies include paid search, where your practice shows up when people enter certain keywords into their search menu, digital display ads that appear when people are searching certain categories, and others are the more popular digital strategies, but it does get complicated from there. And again, we suggest looking at different firms that you can work with to help you in this. The advanced curriculum in this marketing series will actually go deeper into these terms and approaches, but we wanted to expose you to these initial principles now. Next slide. So in summary, developing a marketing advantage includes many steps and discussions with your team. Identify your unique marketing advantage by looking closely at your own professional interests and needs of your community. Conduct market research to delve deeper into patient opportunities and community needs. Use PR and community outreach to reinforce your key idea and build trust, relationships, and thought leadership. Finally, evaluate basic digital strategies to maintain an online presence. This includes a website, social media posts, blogging for thought leadership, and digital media. We thank you for joining us today and look forward to hearing from you after this session on the message board or in person, where we'll be able to provide some thoughts and insights on your questions. Thank you again for joining us.
That concludes today's presentation, and thank you to both our speakers for sharing their time with us today. We encourage you to check out the discussion board to interact with your peers and both Rob and Donna on marketing and branding. If you want more info, please scan these QR codes. It'll take you to some information on LinkedIn and for subscriptions to the Steps Forward newsletter. And we encourage you to check out the website for other relevant resources. Thank you all for your time today.